plans have to meet a set of standard federal criteria for offering a set of benefits that the federal government is going to tell all the plans they have to have. So, for instance, all the plans sold through the exchange have to have fairly robust preventive health services. They have to offer screenings and services that we know people need in order to prevent disease from happening in the first place. The plans have to meet affordability standards so that we know that they're priced in a way that the population that we want to buy the plans can afford those plans.
And will the plans, the exchange, be run by a Colorado state government agency or somebody else?
Well, that's one of the key decisions that the state has to make. The state will have choices. They can run the exchange through a state as part of state government. They could create a kind of quasi-governmental entity, which is what Massachusetts did. They could create a new nonprofit. The state could partner with other states and have a multi-state regional exchange, or the state could say, we don't want to run this ourselves. We're going to default and let the federal government provide these services to the residents of our state.
And the purpose really of these meetings is to gather input and ideas and thoughts and concerns as we look at sort of having to make those decisions.
Right. You've scheduled 7 meetings. The first one begins July 23rd. What are the questions that these that people will be able to provide their input on?
Well, we want to know kind of what some of the principles and values are that people want to see reflected in the exchange. So we want to know how broad of a scope of authority do you want the exchange to be? Do you want it to function as just kind of a basic administrative entity that just makes it easier for everybody, more convenient for people to buy, or do you want it to have a more robust influence on the market? For instance, when Massachusetts created their exchange several years ago, they made a deliberate decision to consolidate the individual market and the small group market into one to make to create an even bigger covered pool of covered lives and have even more purchasing power. So that's one of the things we want to hear from people. We want to hear their opinions about this governance issue, whether the exchange should be run by the state, should it be run by a nonprofit, should we let the federal government do it? That's one of the things we'd like to hear from people. And we also want to hear about their concerns about the benefits package. Even though the federal government will set the floor on benefits or require us to have a minimum set of benefits, states can go above and beyond that. So we want to hear what people think about that.
And how will the larger pool, does that pool negotiate with each of the companies offering insurance? Is that how the consumer is going to get that lower price?
There's a couple things. I mean, each company will have to decide, and it'll be a process, whether they want to offer products in the exchange or in that marketplace or not. And I don't think we're clear at this point in time if you offer products outside the exchange, you also have to offer a product inside the exchange. I mean, that's all part of the questions. As I understand it, is that right, Joan, that we're sort of looking at?
That's true. And the exchange could decide to have plans compete, have a very strict request for proposals and competitive procurement, or it could be more of any willing provider who wants to sell a plan as long as the plan meets the criteria. So that's a really important decision to be made. What we're hoping for by having the forums is to gather people's opinions and ideas and concerns, and then we will capture those and try and write them up in terms of what were the major themes that we heard from the public, from the industry. Was there consensus or any kind of general agreement, if you will, and then we will present that in a document to the legislature, to the next governor. They'll have to actually run a piece of legislation that gives some entity the authority and lays out some of these principles. So we won't make the decision, but we'll try and leave a framework for the next set of policymakers to do that.
Now, the first...
And I would say for our involvement, sort of, I can't speak for CCMU, but for CCHI, I think it's really important to highlight, there have been a lot of things that have rolled out in federal reform right away. I think people are thinking about the exchanges as being 2014. That's a long way off. But as Joan has said, it's really important to start the work now to build the best possible system for the people in Colorado, and that means starting now. There's some other regulations about we have to show sort of progress by 2012. So we're really starting the work early and trying to get as much feedback as we can, and I think that's really important. For CCHI, while we're going through strategic planning right now, I can't imagine that this will not be a priority for us because it's really one of the bigger centerpieces for consumers in federal reform and really is going to allow us to cover a lot more of the uninsured and also better cover the currently insured, I think.
The first of these is going to take place on July 23rd at National Jewish Health in the Molly Blank Center. It's at 9 in the morning. Where can people go to get information about the two that are going to take place in August and the two in September and then into October?
People should track the information on a couple of different websites are available for people. They can go to www.colorado.gov and go to our health reform website on the governor's page, and we'll continue to update those dates